Tonsils, the fleshy masses located at the back of the throat, are sometimes removed in childhood if frequent infections occur. But for those who retain their tonsils into adulthood, there is a risk of developing tonsil stones. In this video, we'll explain what tonsil stones are and what can be done to help prevent them from forming. What are tonsil stones? Tonsils have a sort of bumpy, irregular shape with many pits and crevices. This is completely natural, but because of it, it's common for bacteria and other debris to get caught in the tonsils. When that happens, the buildup can calcify, forming tonsilloliths, commonly known as tonsil stones. When large stones accumulate and remain stuck in the tonsils, patients may experience bothersome symptoms, such as bad breath, swelling, trouble swallowing, ear pain, and a sore throat. Often, small stones go undetected and never require any action because they go away on their own. However, the larger the stones, the more likely a patient will have to deal with them. Depending on the severity of the issue, there are a range of things that can be done about them. Sometimes surgery may be required to remove the stones, but in many cases, at-home solutions will do the trick. But if you're struggling to resolve your tonsilloliths, try these remedies: apple cider vinegar. Gargling with 1 tablespoon apple cider vinegar mixed with 1 cup warm water can help loosen tonsil stones. Garlic. Regularly eating this kitchen staple with antifungal, antiviral, and antibacterial properties may be able to quell the formation of tonsil stones. Yogurt, apples, onions and carrots. These foods also have antibacterial properties that may help combat the progression of tonsil stones. Gentle manual removal. If done very carefully and gently, a cotton swab or clean finger may be used to remove the stones but not recommended. However, be sure to gargle with warm salt water after contact. Cough. Some patients find that the force of a cough can remove the mass. Prevention. If you're prone to tonsil stones, that means that bacteria and other matter is regularly getting caught in your tonsils. To combat this, we recommend improving your oral care routine. Remember to brush your teeth twice a day for 2 minutes each time, to brush your tongue daily, and to floss between your teeth at least once a day. Consume a nutritious diet and drink plenty of water. Additionally, your primary care physician can advise as to whether getting your tonsils removed is the right solution for you. But if you're not going to get a tonsillectomy, superb oral hygiene can go a long way toward preventing tonsil stones. Tonsil removal surgery is a very common procedure that can be performed for a variety of different reasons. What is tonsil removal surgery? Tonsil removal surgery is commonly called a tonsillectomy. It's a surgical removal of the tonsils, which are 2 pads located in the back of your throat. Although your tonsils are part of your body's immune system, having them removed won't make you more likely to get an infection. The adenoids, which are located near the tonsils and perform a similar function, are also frequently removed during the same procedure. The surgery is frequently thought of as being performed on children, but adults also often need a tonsillectomy. How is the procedure performed? A tonsillectomy is performed under general anesthesia, so you won't have any awareness or pain during the surgery. Your doctor can remove your tonsils by using a scalpel or with a surgical tool that uses heat or sound waves to destroy tissue. The procedure will take about an hour, and you'll typically be able to go home the same day. Who makes a good candidate for a tonsillectomy? This procedure is often performed for one of the following reasons. Snoring. Enlarged tonsils can block your airways during sleep, causing chronic snoring and obstructive sleep apnea. This dangerous disorder causes repeated pauses in breathing as you sleep. Infections. Recurring throat infections that occur 6 or more times a year can cause your tonsils to become infected and swollen. A tonsillectomy can be performed if antibiotics aren't effective or for patients who can't take antibiotics. Abnormal growths, tonsil stones, tonsilloliths, may also form and make removal of the tonsils necessary. What symptoms indicate you may need a tonsillectomy? Although some of the following symptoms can also accompany other health issues, they can also be a sign of tonsillitis, inflamed tonsils. Pain that's on one side of your throat, painful or difficult swallowing, fever, swollen lymph nodes in your neck, severe or recurring sore throat, white or yellow coating on your tonsils. What is involved with the recovery of a tonsillectomy? Most people experience some pain after a tonsillectomy, so you'll probably be advised to take pain medication. The pain may get worse 3 or 4 days after your surgery, especially when you first wake up, and it can last for up to 2 weeks. The following can help make your recovery easier while preventing complications. Rest. Staying on bed rest for a few days and avoiding strenuous activities for about 2 weeks. Fluids. Drinking plenty of fluids to avoid getting dehydrated. Easy to swallow foods. Choosing bland, easy to swallow, soft, or cool foods immediately after surgery, such as ice cream, yogurt, pudding, applesauce and scrambled eggs. Avoiding crunchy, spicy, or acidic foods. Thanks for watching. Make sure to subscribe and watch our other videos.